Hello, in this video I wanted to show you how to do a laceration repair tray. So on the tray, you'll notice that we have a sterile drape underneath everything. And we have here, there's a syringe, an 18 gauge needle, as well as a 25 gauge needle. So the 18 gauge needle, so that's the pink one. That one's used to draw up the lidocaine quickly, and the lidocaine is used to numb the patient. And then the 25 gauge, the doctor will switch out the needle because this one is tinier, and so when he injects the patient, it won't be as painful. So we have to numb the patient before we do the laceration repair. Remember, a laceration repair is done to put in sutures for a patient who has a cut. And then we have here, this is the fenestrated drape, and it has a window in it, has a hole in it. So I'm gonna touch the sterile tray, right? But I just wanna show you that hole so you understand the supply. So you can see here, there's a hole right there. So the doctor, once he numbs the patient and the area of the cut has been cleansed by me, the medical assistant, he'll put this over the wound to create a sterile field, but he'll still be able to see the laceration so he can put in his stitches. So that's a sterile drape. It's got a window in it. And then I wanted to show you the instruments. So we have here some forceps, and these, you can see these have teeth on them to grasp tissue. We have here curved scissors, and we also have a curved hemostat. And this right here is the needle holder to hold the suturing material, the needle. There's also some sterile gauze on the tray to wipe away blood as the doctor's working so he can see his work. Because if he can't see, it's hard to put in sutures. And we also have suturing material. So suturing material comes in different sizes and different threads, but the hook and thread are connected together. So this one's a 4-0 black monofilament, and this one is a nylon suture. So the thread is nylon with a 4-0 hook. And it's kind of a picture of it, what the hook looks like. So that's the suturing material that the doctor's requested. And the doctor, he will always ask you in the room he'll say, oh, give me a 4-0 nylon. So then you know what to pull. And off to the side, you want to have surgical gloves kind of prepped for the doctor to put on. You want to have some iodine swab sticks. So these are what you use to swab the laceration because you want to cleanse it. So when a patient first walks in, they're going to be bleeding, and you take them to the bathroom, or in our case, we'd actually take them to the exam room, right? We can wash off their laceration with soap and water to initially cleanse it. And then using the swab sticks, we have 3 different swab sticks we can use to sort of sterilize the site so that the doctor doesn't suture close any bacteria into the wound when they put in the sutures. So it's really important that we cleanse the site as much as possible so that we don't trap in an infection in the patient's body. And we also have here's the lidocaine. So this would be used to sterilize the body part. Not sterilize. It'd be used to numb the body part before we put in sutures. Now this one, it doesn't have any epi because it's not a red label. So This one we could actually use on the fingers, nose, penis, toes, because it doesn't have epi. But if it was lidocaine with epi, you can't use it on those tiny body parts because it causes too much vasoconstriction and can starve those tissues of blood, which could lead to necrosis or dying of those tissues. So when we are trying to repair the fingers, nose, penis, toes, we have to just use regular lidocaine. Everywhere else, we can use lidocaine with epi. And you want to pull out some alcohol too, because you want to wipe off the lid of the lidocaine for the doctor. And then you want to hold it upside down like this with the label facing the doctor, so that he knows and he can verify what he's drawing up before he injects it into the patient, so he doesn't make a mistake. So that's how you hold it for the doctor, with your gloves on, obviously. And then I pulled out here some gloves for myself to put on to help assist the doctor with repairing the laceration. And then I have here also pulled out my dressing and antibiotic ointment for the post-op. So once we got the sutures in, I can cleanse it, remove any blood that's still remaining, and then put on some bacitracin, and that's the bacitracin right there.